Hello, everyone. Thank you very much for having me today. It's quite an honour to present at something like this. So thank you, and thank you for the intro, John. So I've worked with Professor Facconi for around about 6 years in the looking at after trial patients, and now I do the CNS role. So I've got a fair amount of experience in CLL now. So today I'm just going to have a chat about my role from newly diagnosed patients and those patients in active monitoring, and then that stage of beginning treatment. So according to Macmillan, clinical nurse specialists are dedicated to caring for patients suffering from long-term conditions and diseases such as cancer. We're key workers and we treat and manage health concerns of patients and work to promote health and well-being in the patients that we care for. That's quite a nice summary of really what our role entails. Oh, sorry, can you not hear?
Yeah, you need to just
This way. Is that better? Yeah, okay, sorry. So moving on. So if we have a look at the diagnosis, so there's different stages that we'll be involved in. So we tend to meet the patients first when they come to clinic. So most patients won't have an actual formal diagnosis by then. So sometimes they've been referred from other areas of the hospital, quite often from the GP. And it's quite a frightening time for those patients because quite often it's just been a blood test that's been out of range. And then they're sent to this oncology clinic, obviously, and they're thinking, oh my goodness, cancer, you know, with no warning. So we quite often have patients that are there really with no explanation. So it is a very frightening time. So really our job, so I will see patients with Professor Facconi, and it's such a time, it's overwhelming, you know, taking things in, being in an oncology clinic, having the word leukemia mentioned, you know, it's really overwhelming and frightening, well, for anyone, but especially if you've had no warning, sometimes no symptoms. So really our role as CNSs is we'll be there for that part in the clinic, but we'll also be there, we'll speak to the patients afterwards, you know, and we'll try and go through everything and what that means for them. So also a big part of our role is we'll look at not just the patient and their diagnosis, but we'll look at their family circumstances, their home life, you know, what support they need. We'll look at the patient as a whole rather than just focusing on that diagnosis or that disease. We also we're quite involved in the multidisciplinary discussions. So if the patients are admitted, we'll have like meetings discussing the patients, discussing the plan, what we're going to do, treatments. We'll be involved with the doctors. Also, we tend to meet before each of our clinics. So we'll go through each patient, we'll say the plan for them, just so we all know, we're all on the same page, we know what's going on. Psychological support is probably, I would say, the biggest and most important role as a CNS, because it is that side of it, particularly with CLL or the more chronic conditions, dealing with being on active monitoring. It seems like a great option, but actually you've got this diagnosis hanging over your head. You're not being treated necessarily. You may never be treated, but you've still got to deal with this psychological effect of having a cancer diagnosis, which is frightening. So liaise on our part, as a CNS, I will liaise obviously with the doctors, with the consultants. We will do referrals if dietitian referrals are needed, or liaise with the GP. So we're very much almost like a middle person between the patient and the services and the doctors. So we sort of try and gel everything together as much as we can. So family support, obviously, also a huge concern. So you've got the patient, but you've got their family and the worry that comes with that. And we will try and support. We'll provide services. Charity help is a huge benefit that we use, such as the CLL support group. really, really beneficial. And then probably, you know, another big part of our role is helping those patients to make the decisions. You know, quite often now there's varieties of treatment for CLL. It's not always necessarily one pathway. So we'll discuss with patients, you know, what's best for them with their, you know, traveling circumstances or their lifestyle or other comorbidities that they have. So we'll speak to the patients and we'll help them decide what's best for them. So just looking at the active monitoring, which I touched on, it used to be referred to as a watch and wait, but I think that wasn't really a good way of looking at it, because it suggests that you're waiting for something to happen, you're waiting for treatment, whereas some patients will never need treatment and they can live with this condition, you know, just sitting in the background, live a normal life. And this sort of waiting psychologically, it really doesn't help. So we tend to look at it more from like a personal point of view for each patient. So we'll try and, rather than having it as this waiting, we refer to it now as active monitoring. So basically just keeping an eye on everyone, just reviewing sort of 6 months, a year. We'll be there for sort of, if patients do have symptoms, they can contact us. Any questions or uncertainties they have about the condition, about possible treatments, we will be that liaison for them. We'll also try and help with the fears and how to cope with those fears, and what support services are available, such as the charity supports, the things like this, where you can get together and talk to other patients that have the same condition. It really is a huge benefit. We run support groups as well at the hospital, which I think patients find very beneficial, to speak to other people in the same situation. So in terms of treatment, so our role, see some patients will need treatment, as Nora's spoken about. So our role in that is to go through each of the treatment pathways, to explain it. As you found from that venetoclax and obinutuzumab pathway, they can be quite confusing, and we still find that. We work with the venetoclax pathway all the time. It works fantastically, but it's very confusing. There's lots of blood tests involved. There's lots of coming back and forward to the hospital. It's, you know, we have delays in treatment with pharmacy and things. So we, as much as we can, go through that with the patients, and we try and do it by a week by week basis, really. Otherwise, you know, things change, and that's, as CNSs, we're there as that contact. So we will assess and manage toxicities and side effects. So we'll be on the end of the phone or emails. And we also have an emergency service as well, which is available for patients if they are, you know, getting fevers or need to come in. We're always on hand to help with that. So again, personalised care at each patient. You know, each patient will have different needs. Some patients would be very independent, and that's the way that they like it, but other patients will need a lot of support with everything as they go through the treatment. So we'll do referrals if necessary, if we need anything from the GP to help. We liaise with community teams. Some patients are still working, so we'll help them with support with their work, with sickness certificates, or any support that they need with their employers. So again, travel, like some patients, as they're getting through the treatment, they start to travel. So obviously sometimes we need to write sort of letters because they're taking up these medications on the plane and things like that. So that's all things we can help coordinate. And we will help with admission avoidance as well. So we can help manage patients at home with the GP, rather than them having to come into hospital all the time. It's much nicer for them to stay at home. We're also starting up in Southampton now. We're starting up nurse-led venetoclax clinics. So rather than the doctors having to review bloods and things, so we'll be doing that as CNSs now, and that just helps to speed up the process for the patient. We have the doctors on hand if there's something, you know, that needs to be done, but we can just make that a little bit more efficient for the patients as well. We run sort of telephone triage, which, as I say, patients will phone us and we'll try and help over the phone. If we need to get a doctor involved, then we've got them on hand. Like Prof. Facconi's always getting phone calls from me any time in the day. will always help me out. So we work as a really nice team. And also, obviously, if it comes to it, relapse, we're there for the patients then as well. You know, there's many treatment pathways, so we're there to support that. And obviously at that time, it can be obviously very worrying for the patients. So we're always on hand to help with that. So just looking at you know, a real thing, particularly with CLL, is just trying to live well, live a normal life with it. You know, obviously you're going to have anxieties, fatigue can be an issue, like particularly on the treatments, looking at healthy diet. And as Nora said, the importance of exercise, you know, getting out there, you know, keeping yourself fit and well. We will try and encourage that, and we will try and support patients to do that as best they can. So again, as I was saying, that the support available, so we've got within our team, we have 2 consultants, we have lovely registrars that will help us. We have 2 CNSs, myself and my colleague Clara, and we have lovely support worker Frankie, who's at the back there, so she's come along today as well. So you know, we have a lovely team, and we're always on hand to help the patients. Peer support, as I was saying, like support groups like this, buddy systems, you know, speaking to someone else that has the same condition. A lot of our patients have benefited hugely from that, and have made good friends within the CLL community. So it's really important. Again, financial advice is particularly in the climate we're in at the moment. You know, the charities will help with cost of living, anything like that. We will try and help with that as well, and benefits and things that's needed. We'll be there to try and help with that. Counselling, again, as Nora touched on really honestly, and that was really great for me to hear, because some patients don't, you know, they won't necessarily, you know, want to go and speak to someone, but we very much encourage it, because it is, you know, it is a traumatic time. It's a traumatic diagnosis, and yeah, it's really important to speak to people, and for the families as well. It's a really good, you know, resource of counselling. And as I said, charity support is a massive part of how we help patients as well. So really make the most of it. That's excellent services. So in conclusion, so our role as CNSs, it does depend obviously on the disease site, but with CLL, it's, you know, very much a supportive process from the diagnosis, you know, all the way through. And those patients on active monitoring, you know, that's a, you know, if you are on active monitoring, you shouldn't feel that you don't need that support. You should always get in touch if you've got worries or symptoms and things. So patients will generally require more support at diagnosis and relapse, understandably, because there's a lot going on then. But as I was saying, the psychological impact of the active monitoring is something we're very, very aware of. So we're very keen to help anyone in that situation. So as services develop, the roles of CNS, it will change. So we're developing at the moment a patient-initiated follow-up. So that's something we've added in. We've added in our venetoclax clinic. So we are taking on more roles as CNSs and being more you know, involved in all parts of that treatment pathway. CNS, we will try and keep, like I said, keep patients out of hospital. You don't want to be admitted to hospital if you don't need to, and we'll try and manage patients' needs at home as best we can. And we have evidence that CNSs do improve the patient experience, and I, you know, I very much hope that's the case, and I hope you all have access to a CNS that can help you. So yeah, I think that's it. That's it for today. Thank you.